It's the Monday, April 20th, media availability with DHHS Director of Behavioral Health, formerly known as Mental Health, Ms. Emi Botzler-Rodgers. Thank you so much for being here with us. First question, has county mental health seen an increased demand for services, and if so, what has it done to meet that increase with the restrictions necessitated by shelter-in-place and social distancing?
So I wouldn't say there's necessarily been an increase in demand, more of a shift for the type of services that are needed. What we have found is that in response to COVID, people are more anxious and worried and distressed and often just want somebody to talk to listen and support how they're feeling. And so one of the things that we've done is we've opened up a COVID community mental health line where people can call and just have someone to talk to about whatever they're feeling related to this event. That number, just so that it's out there, is 707-268-2999.
Excellent. What strategies would you recommend to help people maintain mental and emotional wellness through the increased isolation and anxiety of COVID-19 and the shelter in place, or to help their neighbors do the same?
Mm-hmm. So, many of the things that people already use for coping are good in this case too. So self-care that includes exercise or healthy eating and making sure that you get enough rest, drink enough water, those kinds of things are really important. It's also important in this situation to take breaks from media and the news so you're not just absorbing too many details on something that's so stressful. And then finding ways to make contact with people as we can in this current state. So with neighbors or others, family and friends, making phone calls, doing FaceTime, anything you can do to have contact that's still creating safety for everybody.
Great. What is county mental health's role during the COVID-19 pandemic, and is it doing anything to help residents with feelings of isolation?
Mm-hmm. So kind of similar to the first question, our role is the same. We provide essential services, so we continue to provide those services, the whole breadth of them. We modify them as we need to, and we're lifting up additional services where needed. So for instance, the COVID community mental health line for just the general population to be able to call and have some support.
How have operations changed at Semper Virens, and has demand for it changed since the shelter-in-place went into effect?
So SV has rolled out several phases of a mitigation plan and, of course, are responding pretty tediously to COVID-19. They've increased, certainly, screening people when they come, increasing use of protective gear, making sure that both staff and patients are protected. There are some instances where they're able to do use telehealth for services. We're also really trying to manage how to respond to anyone who tests positive for COVID on the unit and setting up ways to provide isolation for those individuals. We've recently requested a waiver from the state to expand our space around SV, and we'll be looking to do that by moving our crisis stabilization unit to the first floor.
Okay. Has Humboldt County seen a rise in suicides or other self-harm cases since the shelter-in-place order was issued? And if yes, can you share those figures?
We really haven't, and that's not uncommon across the state. There just hasn't been an increase in suicidal ideation, behavior, or other kind of crisis situations.
That's great. What services are currently available for those experiencing a mental health crisis, and how can people obtain them?
Just the exact same, so we still have the same services. Those are essential. So crisis response is part of that. They would still call the crisis line, which is 445-7715. The difference is that we'll do the parts of it remotely that we can, and again, using telehealth or telephone, and we'll really practice social distancing and wearing protective gear when we have to be face-to-face.
Has there been a surge in local people experiencing mental health issues? And if so, does the county have sufficient resources to handle that?
So, we haven't really seen a surge to date, but any kind of surge response that we have to do will have to be in partnership with other organizations in the community. So the biggest place where we would have surge capacity issues would be on SV, and so that really requires us to partner with law enforcement and our local hospitals around how do we kind of respond and manage clients that come in, often shared clients that come in these situations.
What resources are available for parents who are concerned about their children's mental health during this time?
So still the same resources that have always been available in terms of services. Our children's clinic is open and operating and taking new referrals, so that's there. There's also, as I mentioned, the COVID community mental health line, and that's also an opportunity for parents to call and just say, gosh, here's what I'm seeing in my kid. Do you have any suggestions? What can I do with them in the short term? Do they need treatment, or are there some strategies that I can implement?
Is there an increase in calls from elderly residents or their caregivers concerned about depression or other issues? And what resources does the county have to support people in that situation who are at most risk for the virus?
There hasn't necessarily been an increase in calls from that population. We do have, however, providers and teams that work with that group, and they have done quite a bit of outreach just to check in and see how people are doing. We have targeted people over the age of 65 and people without current caregivers to just reach out and ask how they're doing, offer services. We've also, in that arena, been able to get some flexibilities around offering care providers on an emergency basis if that's needed.
Regarding the need for mental health services for people who are victims of domestic abuse or violence locally, what degree of new incidences are being exacerbated by the shelter-in-place order, and can you talk about the connection between the two?
I'm not aware of the numbers related to that, but absolutely there's link between stress and violence. And so here we are with COVID, and people are isolated, and they're also worried about money and health and relationships, and all those things are stressful and contribute to certainly domestic violence and other types of abuse.
Has mental health had to make adjustments to staffing numbers or the number of patients under custodial care in order to comply with the distancing requirements?
So none of the residential facilities have changed staffing ratios. So the staffing ratios between patients and caregivers continues. Just additional levels of protection and social distancing and protective gear are being implemented.
Excellent. Thank you so much.
All right. Thank you.